is just a huge honor for me today to be podcast interviewing one of my mentors, one of my idols, William Dickerson. Can I just call you Wild Bill like we do when we're in
Sure,
Vegas?
that's fine.
My God, like so many dentists, Dr. Dickerson was busy creating a practice based on the skills and knowledge he obtained in dental school. However, he was increasingly frustrated and disenchanted by the traditional approach to dental care. Developing a patient-centered practice gave him his passion-driven purpose. Propelled by this new excitement for dentistry, Bill started sharing his passion with other dentists and quickly became recognized as a respected opinion leader and highly sought-after speaker, as well as one of the most influential people in dentistry. He was instrumental as a pioneer in the aesthetic revolution, as well as igniting the profession's interest in the physiologically based neuromuscular dentistry. His focus for the past 2 decades has been to create a better future for the profession. In 1993, Dr. Dickerson was asked by Baylor College of Dentistry to develop the first live patient treatment program in the country. Since 1994, Bill's efforts have been channeled into creating the Las Vegas Institute for Advanced Dental Studies, LVI Global, providing an educational forum for advancing our profession. The construction of the existing campus was opened in 1998 and was expanded to 63,000 square feet of buildings on 4.5 acres of land in 2003 in the beautiful Summerlin area of Las Vegas to create an environment that enhances the learning experiences of the attendees. For the past 20 years, LVI has led the way in continuing education, becoming the world's premier postgraduate education center in dentistry. Over 9,000 dentists from all over the world have attended LVI, and over 10,000 of their patients have been treated there, as well as the thousands of others who have enhanced their practices by attending lectures of Bill's or reading his books to help dentists achieve their dreams. The Exceptional Dental Practice, the sequel, In Search of the Ultimate Practice, How to Create an Exceptional Aesthetic Practice, 10 Dentists That Have Done It, and Unleashing the Power of Dentistry. Dr. Dickerson has also published over 500 articles and lectured in every state and most Western countries. From aesthetic dentistry to scientifically based occlusal approaches, Bill has encouraged, assisted, and propelled dentistry for over 43 nations to grow. I was trying to think this morning what year I went to LVI. I went there early. I was one of your first few classes, wasn't I?
Yeah, but I'm just tired after you read all that. I did. Yeah, I think, Howard, I think you were there in like 98. You were one of the first, 97 maybe 96. It was a long time ago.
Yeah, but Bill,
You had hair then.
I had. Did I really have hair? Bill,
No.
I'm telling you, seriously, when you talk to anybody about the aesthetic revolution, it's just your name. I mean, everybody credits you for igniting the whole thing, and also you also worked with a great company, Ivoclar at the time, and you know, all their new materials, and man, I'd say from 93 to 2000, the only thing anyone ever talked about was aesthetic dentistry, and you led that revolution. Congratulations on that. Seriously, man. I mean, I tip my hat to you. That was just an amazing feat that you pulled off.
Thank you, Howard. I was just doing what I believed in at the time. It wasn't like I don't think I was trying to pull anything off. I mean, I was just going around lecturing what I found exciting about dentistry. And then you're right, the 90s were the aesthetic revolution, but that's kind of come and gone, don't you think?
Well, I think it was the baby boomers were, you know, like a snake swallowing a rabbit. I mean, the baby boomers were that big demographic thing,
Right.
and they were replaced by a much smaller unit of millennials. Now that the big baby boomers has gone into retirement, so that's why you see the implant revolution coming off and surgical guide and all that, because now they're all getting implants and keeping their teeth. And then we have an echo boom, not from the baby boomers' children, the generation next, but the millennials had an echo boom in 2007 with 4.3 million kids. Combine that with Obamacare's mandating that children be covered for dentistry. So now the pediatric end is exploding on the left. The seniors are rolling into implant dentistry, but still, but cosmetic dentistry. I mean, how many dentists won't even do amalgams these days? I mean, so you know that was a lasting impact. I'd say what you did was a lasting impact.
Well, good. I'm glad.
So what are you up to now these days?
Well, where do you want?
What's got you excited? What's got you passionate?
Yeah, you know what? That's so funny too, because passion is exactly what I feel for the last probably 16 years, my passion has been the physiologic approach to dentistry and trying to spread that message to people because it's so powerful. The cosmetic revolution was great. You're right. It made people feel better about themselves. And, by fixing smiles, people who maybe were self-conscious now had this better confidence and maybe they did better in their profession. But with the physiologic approach, it's not just making them feel better about themselves, is that we're really eliminating a lifetime of pain that no other health provider can. So that's exciting because we're changing lives from a health aspect. And add on that, because directly connected with that is the whole sleep medicine, which I think is the future of our profession. And I'm hoping, and I'm working hard to try and make it that dentists become or at least are able to diagnose sleep apnea, because that's in our lap. I mean, that's the oral box is what's causing the sleep apnea, and we're the ones that look at that several times a year. And the sad fact is medicine hasn't been doing a good job with it because so many people go undiagnosed.
Well, Bill, let me start this discussion with a specific question. On Dental Town, and they're always asking or saying, look, I'm coming out of school, $350,000 student loans. I want to learn all these things. They say, I want to learn Invisalign. I want to learn place implants, or I want to learn CAD/CAM, or I want to learn sleep apnea, or I want to learn TMD. But specific to TMD, they say, okay, it looks like there's two camps, and I don't have a lot of money. I don't want to learn all the camps, but there's a neuromuscular camp and what they would call maybe a CR Dawson Pankey camp. So they that's the decision in front of them right now. You're talking to thousands of young dentists who have to make a decision. Do I go neuromuscular or do I go CR? What would you say to that kid?
Physiology is so important in our bodies that you need to go to the one that makes the most physiologic sense. Obviously, I believe it's the physiologic approach. When muscles are what causes the pain, we need to make the muscles happy. And CR is more of a mechanically based position. And you know as well as I do, Howard, is that most people that learn CR don't actually go home and practice it. Whereas 100% of the people that learn our physiologic approach actually implement it in their practice and do it. It's easy. And today, because of the evolutionary changes that have occurred, and I will tell you that there's probably been more changes in that physiologic approach since LVIs got involved, which started in 1999, so it's been 16 years, we're going on 17 years, there's been more changes out of LVI than the 40 years prior to that, simply because of the LVI is this virtual laboratory. We get thousands of patients come through, we get to see all these different cases, and we keep figuring out better ways to do it. And the cool part is today, with the evolution of what I developed as the tag bite and the new equipment, you can literally become a physiologic-based dentist for less than $1,500. I mean, that's about all the equipment that you need. So it's interesting, and if I can just kind of go back a little bit, is that in 2008, well, you know that I sold LVI in 2005. Now, I bought it back in 13, but in 2008, I stopped traveling on the road to lecture and just decided I'm only going to lecture at LVI. I was tired of the traveling, but I'm so passionate about now how easy it is and how predictable it is to achieve these results where these people literally will eliminate headaches and migraines and neck pain, back pain, and recover from sleep apnea without having to wear a CPAP. Introduce people like you're talking about very cheaply for $7.95 so that they can determine what approach they want to take. And I will guarantee you that anybody who hears this ends up adopting our approach. When people come out to our Core 1 at LVI, like this we just finished the Core 1, at the end, I ask on a anonymous clicker, how many of you now believe the physiologic approach is right? 100% believe that it's right by the end of the program because it makes so much sense, there's so much science behind it, and it's so logical.
Okay, Bill, the most people who email me, Howard at dentaltown.com, in this podcast it seems like about 20% are in dental school, and it seems like they're all under 30, and about maybe 1 out of 100, some guy will send me an email and all I'll say is, hey, I just want to let you know there's an old guy listening to your show. So let's back up a little bit. I think, we've done this 3 decades. Can you go back and kind of explain the difference in CR and neuromuscular? I try to estimate the questions they're thinking.
Yeah, yeah, absolutely. I will. And let me also say that since you have such a young audience, if these are people in dental school or just right afterwards, for the first year after dental school, we actually allow the dentist, whatever course they want to take for that first year, they get half price off because we know they're struggling and we know they have a debt. So let me kind of explain it in a nutshell because it's a very interesting question. But if you think about the development of CR, it was really for dentures because they had no way to mount casts without finding some way to get close, right? But they never really actually built them there. They put the wax rims in, had the patient become comfortable, and somewhere along the line, they made the decision that, okay, we're going to apply this to teeth. And so it looks like it fits, right? Because they take the condyle and they say, well, it needs to fit up there. But what they're forgetting about is that bone remodels due to forces placed upon it. And it's the muscles that cause the pain. 90% of pain comes from muscle. Janet Travell, back in the 60s, Johnson and Kennedy's physician, coined that term. And that's true, that most of the pain that we experience is muscle derived. So what we want to do is make the muscles happy. And coincidentally, when we do that, we decompress the joint. And if you see the picture of a tomogram or a cone beam, which would be great if everybody had one, and get me off that subject because everything's so expensive in dentistry that the average dentist can't actually practice good dentistry because they can't afford all the equipment. But generally what happens is that when people have TMD, or CMD, I actually like is better because it's craniomandibular dysfunction, the head of the condyle is distalized. And so you have this distalized condyle, which is why a lot of times they have clicking and popping. They say it's an anteriorly displaced disc, but it's actually a posteriorly displaced condyle. So when we decompress them, the joint literally decompresses and they recapture the disc. We're the only medical specialty that wants to compress joints. No other medical specialty compresses joints. You break your leg, they don't shove your lower leg into your knee socket and put a cast on. They let it hang and decompress. But for some reason over the years, we decided to do that. Again, you know as well as I do, though, that they don't actually practice that. They teach it, but they don't actually practice that. It's funny because when we come in, we have, again, an anonymous clicker survey, and, there's always people that have taken, well, first of all, they learned it in dental school and then postgraduate school. But like in this last class, nobody was actually doing it. I take that back. One guy out of the entire class that learned was actually saying that he practiced that. Conversely, those that learned the physiologic approach practice it because it makes so much sense and it's comfortable for the patient. You get immediate results. So the difference is theirs is more of a mechanically placed position. Let's take that condyle and seat it up into the fossa. Whereas ours is a muscularly derived position. Let's make the muscles happy. Let's relax it so it's in its ideal working length. And then let's make the bite near that. And in a nutshell, that's kind of the difference.
Well, when you said you wish they all had a CBCT, I've never met a dentist where the specialist around the corner, whether it be a periodontist, orthodontist, oral surgeon, they all want referrals. And every oral surgeon, periodontist I've talked to said, oh, if a general dentist wants to send a patient over a CBCT, I'd love to. I mean, what's the flip? I send you donuts or I take you out for lunch. So those specialists are dying for a relationship with their
Yeah,
GPs.
no, that's true.
But you said that neuromuscular dentistry needs equipment. What type of technology equipment do they need, and what is the name of your intro beginners neuromuscular course? And how would they find information about that?
Obviously, go to our website, lviglobal.com, and they'll see all the courses. In fact, you were mentioning all the things that they want to learn. Every one of those things are taught at LVI. Ortho, implants, we dentures, TMD, sleep. So pretty much everything is covered at LVI. The entry-level course is called, it's always called Core 1, but I'm trying to remember the official name of it is Functional Physiologic Dentistry.
So at LVI, it starts at Core 1. How many cores are there?
Well, you can start in dentures, you can start in implants, you can start in ortho. The core courses for really the approach to physiologic approach to dentistry, there's 7 core courses. You don't have to take them. The first course, you're going to go home and start making orthotics for people and getting them out of pain. And that's obviously will Propelled people to then want to learn more
And
about.
as I remember LVI the most is the gambling bill was always larger than the course bill. Is that
Well,
still
well,
the
well,
problem?
that's why we're out in Summerlin. So it's more difficult to get downtown. But getting back to the expense involved, and that was an issue in the past. Before LVI got involved, the company that made the equipment said, in order to practice this type, you have to buy this. At that time, it was 20,000. Now it's $32,000 equipment, and I'm telling you that's absolutely not true. Now the approach to get into this, and their TENS unit currently today, for example, is $2,500. You can get a micro TENS from Microdental. They make a TENS unit to go along with their the Micro 2 sleep appliance, and I'd love to talk to you about that because I think it's amazing. But anyway,
Microdental's the big lab out in San Fran.
yeah, they actually have labs around the country, but their main office is in Dublin. Yeah,
Is that I met one of the ladies that used to run it. Was it Laura Kelly?
oh, she hasn't been in micro for, I don't know, maybe 15 years.
Oh,
So
really? Oh, okay. I'm
so wait,
53.
so let me get
I'm
back to
dating myself.
let me get back to the cost because I think this is important. Is they had a $2,500 TINS, and then so Microdental created their own TINS unit for $279. It does exactly the same thing. So somebody needs a TINS unit to relax the muscles. And then they need a occlusal plane analyzer articulator, and Stratus from Ivoclar makes a good one with the LVI occlusal plane analyzer for it. And I think that's like $1,500 or something. I'm not positive, but that's just so you can analyze the occlusal plane. Could you do it without that? Maybe, but it's good to have that. And then the other thing that you need, and with the development of the tag bite, which I just recently came up with after 16 years of finding we always get to the same place, is bioresearch makes a thing called the M scan, which you would hook to the anterior temporalis, which are really the reins of the mandible, and you can tell whether a bite is good or bad by measuring the anterior temporalis. And this thing measures the anterior temporalis for $995. So really, with a TENS unit in the M scan, you can be pretty sure you've got a good bite for less than $1,500.
Some of the older neuromuscular guys always say you have to have a T scan from Tech Scan.
No, I love the T scan. You don't have to, but is it make you a better dentist? Is it easier for you to finish your cases, both your orthotics and your final work? Absolutely. I love the T scan. And the cool thing about the T scan and the bioresearch company is their software is integrated with it, so you can run a clinch score measuring the activity of the masseters and the temporalis, for example, and it correlates in time with what tooth hits first. So that's kind of cool too. If you ever decide to go on and get the more expensive equipment that would make you a better physiologic dentist, for example, then you can tie that into the T scan. But the thing about the T scan is most people use it wrong. Most people actually just measure force, so they have them bite all the way. It's really the timing that's important, is what tooth hits first, and never get all the way to force until you have a nice even bite.
Amazing, Bill. I would do anything if you did an intro course on Dental Town. That we put up. We got 215,000 people on Dental Town, and then we came up with the app. It's 50,000 dentists have the app, 1,000 a month download the app. But we put 350 1-hour online CE courses. They've been viewed 600,000 times. I think it'd be the best marketing you ever did.
Sure, I'd be glad to.
Give an hour intro, because if you go to the message board and type in TMJ, TMD, whatever, there's so much debate and confusion about neuromuscular versus CR. And like I say, the kids just want to know, do I turn right or turn left? Where do they go first?
And the only thing I will tell you is anybody that criticizes physiologic or neuromuscular based dentistry, I'm not crazy about the term neuromuscular because it's been so, I don't know, it's been made into, somehow it's been tagged as bad and that's really not, it's more physiologic, it's physiologic based, but regardless of whether you call it neuromuscular or physiologic, those that criticize it have actually never listened. And I want to invite you as my guest to come out to our Core 1 program and sit in there for 3 days, and you will leave, I guarantee you. By the way, we guarantee every course we give, the roadshow, the courses in Vegas, if they're not happy with being there, if they don't think it was worth the effort, we give them their money back. 16 years, nobody's ever asked for their money back. It's from the physiologic approach. And what I'm telling you is if you come in and just sit for those 3 days, you can come back and decide on your own. You'll see how much sense it makes and how logical it is.
I
But
love Vegas. So we're doing this year will be our 15th annual townie meeting, April 2017. You should lecture at that. God,
well,
you don't have to drive
you got
across.
to invite me.
Oh, come on, Bill. I've sent you and your
No,
wife.
you've never
I
invited me to speak at your meeting. I would love to speak at your meeting.
Oh, well, my God. Email me, Howard at dentaltown.com, and I'll reply to Marie Leland is in charge of speakers. And I think I also sent an email to your wife, Heidi. She's a dentist, isn't she?
Yeah,
Yeah.
she's very instrumental at
Yeah.
LVI. In fact, she's sort of the OMD, the oral mandibular dysfunction, which is a real critical part of both TMD and OSA. It's all related. It's all physiologic based. TMD is related to OSA because they're caused by the same thing, and the whole myofunctional disorder problems that occur out there because of all the baby boomers that you were talking about. And I'm a perfect example, by the way. 4 by extraction, headgear, retracted maxilla. I'm actually expanding my arch right now, so if I'm slurring my words, it's because I have brackets all on my upper arch
Well,
as I
Bill,
expand my arch.
let's just go through the common things that people say against neuromuscular dentistry, or for that, CR. First thing is, come on, Bill, when people eat, their teeth don't even touch.
Well, actually, that's not true. They hit a pinpoint spot every time they touch. If anybody looked at a chew cycle, which we show in our courses, you'll see that you actually hit this pinpoint spot every time that you touch. But let's assume that that's correct. So what? What does that have to do with CR? Or, in fact, that's more supportive of the physiologic approach than CR, because the whole point about CR is, well, you have to have that class 3 lever, and in order to get a good chew and a good function. And yet there's people out there, which we show a video clip of somebody chewing without a condyle. In fact, a lady without even half of a mandible, because the bracing mechanism of the jaw is actually the teeth, which is why dentists are so important. Because if you, and we've all done this, and you've done this, you've prepped a quadrant, right? You took a bite, you sent it to the lab, and the lab called you and said, you didn't give me enough room. It's happened to you, hasn't it? Okay, what happened is you compressed the joint because you took away the door stop. You took away that posterior stop by prepping and taking a bite. You've now, that because the tooth were the stop that prevented the condyle from compressing into the joint. That's why it's critical for you to maintain that posterior stop when you take a bite and then go back and prep the rest. These are all kinds of things that, by the way, we discuss on the 2-day roadshow. If anybody, we're in Virginia in June.
Hey, we should have you speak at LBI, and then rent a big bus or something and have you give an open house and show them the facility.
Be glad to.
That'd be really fun. I want to tell you another thing. They're always saying on the message board. They're saying, and I hope this doesn't come off as sexist. It's like, but Bill, this has nothing to do with the teeth. It's all mental stress, and it's 80% women, and it's just a bunch of crazy women. It's all mental. It has nothing to do with rocks in their mouth or muscles in their jaw.
That's absolutely
I would never say a thing like that. I'm just repeating. I'm just repeating what I hear.
That is such an asinine statement. So really, people believe that somehow women are more susceptible or less tolerant of pain, and they're crazy. Let me just tell you something. My true belief is that if man had to give birth, everybody would be an only child. Men tolerate pain much worse than women do. There is a reason that women have TMD more than others, but it has to do with the trigeminal complex. 40% of our brain's activity actually deals with the trigeminal complex. And those people that say those kinds of things, all they have to do is come out and listen for themselves, and they will find out the answer to all that stuff. Because it's, everybody that says that stuff has never heard it, never listened to it. They're just listening to somebody else say something about it and criticize it.
Well, you got it. You're doing these 2-day road shows. Put some effort in that online CE, and it's
Yeah, I'd be glad to, Howard.
that would clear up a lot of confusion. Did you want to speak more about neuromuscular, or do you want to go on to the other cores that you teach: ortho, implants, dentures, and sleep?
Oh gosh. Well, first of all, I don't teach the implants or the dentures. I have a faculty that teaches that.
Well,
I do want to talk a little bit about the connection. It would be great for people to understand the connection between TMD and OSA, because think about
OSA,
obstructive sleep apnea. Sleep disorder breathing is is second only to smoking as one of the causes of death. In fact, I don't know if you know how Antonin Scalia died, right? His CPAP was by his bedside. He died basically of sleep apnea. And there's
What, he
so many.
forgot to plug it in?
Yeah, he didn't use it. He was lying on his bed. It was right next to him unplugged. If he had a oral appliance, he would have just slipped it in his mouth and been fine. And if let me just kind of go back a little bit about the common logic here. If you're CR base, you push them back during the day, and then they put them in a George gauge at night to create the sleep appliance, jacking them way far forward, 70% of protrusion. So it's like a yo-yo effect. They put them back during the day, forward during the night, back during the day, forward during the night. The physiologic approach is we put them in the same position day and night. So when we tense and relax these patients, they generally will come down to where the physiology is, where their muscles want to be, and the bite will be held there. Yes, sometimes we need to titrate somebody a little bit more, but we just did a survey, and it's in our Visions magazine, and anybody can go online and look it up. We did a survey where we had the alumni send in all their sleep study cases, and we literally took severe sleep apnea patient and got them to normal levels. And the average before was like, I think it was 25 HI, and the average afterwards was like 4. And the average titration was 0.42 millimeters. So when you start off in the physiologic approach, and because we relax the muscles of the airway, it opens up and they heal and they're much better off. So the Micro 2 was developed around, and I'm excited about it because Micro asked me to help them develop the Micro 2, but it's a lingualist. The vertical fin keeps the airway if they open their mouth. Again, all these things we talk about in the 2-day roadshow, but we also have our sleep apnea course, which we're very excited about.
You've been working with Microdental ever since I met you.
Yeah, and Orem and Williams Dental Lab and Ivoclar and Bisco, they all are sponsors of LVI. But yeah, they're all good companies.
Yeah. Okay, I'm gonna throw one last piece of mud at this whole occlusion debate. If occlusion even mattered, come on, Bill. There's 10,000 orthodontists. If you cut the number of orthodontists in half, their half would be more than the 5,000 oral surgeons, the 5,000 periodontists, the et cetera, et cetera. 10,000 orthodontists take all the rich American kids and blow out their Curvis Fee, their Curra Wilson, flatten everything out, put them in group function, and it didn't harm America. So how could occlusion matter? I've heard that said so many times.
It did harm America. I'm a perfect example of it. Again, the 4 by extraction retreated cases, but there are a lot of TMD cases as a result of ortho, and we see that all the time. The thing about TMD is it's sort of the masquerading problem. People have headaches, but they don't know what causes them. Of course, they take drugs. People call them crazy women. There's all kinds of, they label it fibromyalgia. There are so many things that cause, or that people think cause headaches, but I will tell you that most of it, and I know people are going to freak about that, most of it is the way the mandible relates to the maxilla. And again, the whole trigeminal complex. But for me to sit here in a podcast and trying to explain really what is a several day lecture is awful hard to do. But what I'm telling you is that they have been messing up people for years. And you ask any physiologic based or neuromuscular dentist, and they will tell you that they see a vast number of orthodontically treated cases come into their offices with TMD. And the beauty is I'm talking migraines too, Howard, is that in fact, there has never been a migraine sufferer that I have treated that we couldn't help. Heidi is treated and she couldn't help. And I don't even know if any of our faculty have ever treated one that they couldn't help. And I know that seems, again, bizarre, but people need to find out the truth about it before they start making conclusions and start saying stupid things that, my motto is never become a critic based on ignorance. And my favorite line of Omer, and I love Omer, and Omer has great lines. Omer says, you can't be down on something you're not up on. I just love that line.
I love Omer. I text him. I think we text each other 2 or 3 times a week. He lives up the street from me. We're in the same town. Hey, I think one of the biggest game changers in sleep apnea is actually the New York Times bestselling book on right now, The Sleep Revolution: Transforming Your Life One Night at a Time by Arianna Huffington. That woman owns the Huffington Post. She's on every talk show, and I'm been having patients ever since that book came out just recently. I mean, everybody's talking about it. I've had patients actually bring it in, so I think it's you know when did you say when would you say it first really appeared on the dental scene? Obstructive sleep apnea.
Well, at this year's IAPA meeting, by the way, which is the greatest organization in dentistry, it's actually going to be held on our campus. We're having the father of sleep apnea, and he actually is a professor at Stanford, and he will be speaking on there. And he developed and coined the term sleep apnea, and he coined the term UARS. So it's been around for a while, but really,
What's his name?
yeah, I knew you were going to ask me that, but it's a French name, Guillaume or something. I actually can't pronounce the name. But again, they can go on our website and see his name. He's one of the keynote speakers.
And
But
when's he speaking? Where's it at?
it's on the LVI campus in October 13th through the 15th is the IAPA meeting, International Association for Physiologic Aesthetics, and he's speaking.
IAP?
IAPA.
IAPA. Is that going to be at LVI Global?
Yeah, you can see it on our website. Yeah, there'll be a link there. But no, actually, you know what? Go to theiapa.com.
It's called
Theiapa.com.
theiapa.com. Okay.
Right. But anyway, it's really, if you think about it, 90% of people with sleep apnea are undiagnosed because physicians don't recognize it. They don't screen for it. Unless they're a sleep physician, they really don't screen for it. So statistically, they believe that 80 to 90% of people who have sleep apnea go undiagnosed. And the vast majority of those are giving CPAPs. And 60% of people stop using CPAP because it's uncomfortable and they don't like it. And that's why dentistry is so important, is because we can create a oral appliance therapy that will actually open up the airway. The problem is that oral appliance therapy has caused problems in the past, and that's why physicians don't want their patients to use it. Because they move the mandible too far forward, they end up developing jaw problems. So again, getting back to the physiologic approach, put it where the muscles want to be, and you won't have any morning pain. The jaw will feel fine in the morning. The other thing is that you get a headgear effect, where if you protrude the mandible too much, it wants to come back, and so it's actually pulling the maxilla back. But that doesn't happen with a physiologic approach because you're where the muscles want to be, so there isn't that force wanting to pull it back. But I am telling you, I believe the future of dentistry is with sleep apnea.
Well, I believe you're the future dentistry because you were the past, you're the present, so you have to be the future. Seriously, Bill, and in all seriousness, you did so much for me personally. I mean, I went down there with my friends and assistants, and you were maybe one of the most important mentors I had in my
Oh, that's
early
nice.
career.
Thank you. Well, come back and
No,
sit in
I would
the
love to,
cold
and I
one.
love the drive. You know, I hate traveling too. I hate airports. You know, I tell everybody I get paid to travel. I speak for free. I love that drive from Phoenix to Vegas, especially after they redid that bridge
Yeah.
over
Oh, that's
Hoover
funny,
Dam.
by the because I hate to drive. So the lucky me, and one of my other passion besides dentistry, and
Is
literally it
flying.
is passion. Yeah, it's flying. But dentistry is my passion-filled purpose. I believe both Heidi and I believe that's why we're here is to change the world of dentistry and make it more powerful than certainly what they learn in dental school, and that's exciting. But I love to fly. So
Hey, I want to ask you other things. A lot of the young kids are thinking, well, okay, so we have Dental Town and we have Ortho Town. One of the
right.
biggest complaints on Ortho Town, so I hear, because I'm not allowed to go on there because I'm not an orthodontist. I own the site, but I'm not allowed to go on it. You can't go on that site unless you're an orthodontist. But they don't like the GPs doing short-term ortho. They don't like them doing Invisalign. And it's kind of, I want to ask you, because I know you'll say things that are politically incorrect if you believe them. It seems like in school, the endodontists
Wait,
help you.
are you saying I'm the Donald Trump of dentistry?
I think we both are. We both are. We both. The funniest critique I get is that I'm paid or I'm bribed or someone else. It's just hilarious.
Yeah, me too.
But they the endodontist will. You can go to any endodontist office in Phoenix, Arizona. You can drive right over to Brad Gettleman and ask if you can watch him. They don't care. Oral surgeons, they'll let you watch. in dental school, the oral surgeons try to teach you to extract teeth. The endodontists try to teach you how to do endo. Everybody, the pediatric dentists, they try to teach you how to do pediatric. But the orthodontists don't want anything in their curriculum. And they just really believe that if you want to do ortho, you need to go to ortho school and be an orthodontist. So I want you to address, why is that? And number two, because a lot of kids are saying, well, I don't want to be an orthodontist, but should I do this short-term ortho? And the most exploding thing in the ortho market from here, I just lectured in Asia, Africa, all around the world, is Invisalign, these clear retainers. And also now there's a new lower cost knockoff to the more expensive Invisalign. What is it? Clear, correct?
There's lots of them actually.
So address all those. I just threw 28 questions at you. Pick 3 and answer them.
No, you're absolutely right. That's been my criticism at dental schools. The orthodontists that teach in dental school don't want you to know anything because they don't want you doing ortho. And the reason that they don't want you is because it's easy. It's incredibly easy. We do get orthodontists that go through our program, and then they end up becoming neuromuscular orthodontists or physiologic-based orthodontists, where they move them to that physiologic position. The problem is that orthodontists are so busy that they don't want to learn, and so they're literally screwing up patients by either extracting the bicuspids or putting them in a retreated position, or even worse, making them go through surgery. You remember the show Extreme Makeover? Dorfman would do those cases, and then they would put the jaws would be so far back, so they put these chin implants in. But if they brought them to where they were physiologically supposed to be, they wouldn't have had to put those chin implants in. Their faces would look better. They wouldn't have been so collapsed. And speaking of Trump, if you look at him, he's totally overclosed and collapsed. He's got the deep middle fold here, and because he's not in his physiologic-based position. And people with forward head posture, it's a result of them not being in their physiologic position or having a restricted airway, because moving your head forward opens your airway. It's like giving CPR, right? So my point about the orthodontists is that number one is that they're so busy they don't want to learn. But number two, it is so easy to do ortho. It is so easy. And our ortho programs are generally general dentists going through it. And they actually end up doing a better job because they do it physiologically. So I'm really excited.
Do you have an orthodontist teaching it or a general dentist?
No, it's two general dentists teach it.
Who are your 2 general dentists?
His name, one is David Buck out of Seattle and Tim Gross out of South Carolina.
Tim Gross?
Yeah, great guys. Their program's phenomenal. And literally, people will go back on Monday and start doing ortho.
So David Buck's out of Seattle?
Right.
And Tim Gross is out of where?
South Carolina.
Huh. I wonder if I know him. Well, let's go back to how long does it take to go through their program?
Well, their first level program, where they will actually go home and start banding and bracketing, putting people on, is a 3-day program. And then they'll come back for advanced courses if they want, and then get.
And is a 3-day program usually a Friday, Saturday, Sunday, or is it a Monday, Tuesday, Wednesday?
I believe it's a Thursday, Friday, Saturday, but I'm not sure exactly on that. You'll have to look at it, but I'm pretty sure it's a Thursday, Friday, Saturday.
And if someone was listening to this, because I'm just trying to estimate their questions, that's all I'm doing. What casino on the Strip would be the closest to LVI Global?
Well, not on the Strip, but there is the most of the people that come to LVI stay at the Red Rock, which is a phenomenal hotel. Right behind the Red Rock is downtown Summerlin with all the stores and the shops. But every hotel in Vegas.
But is Red Rock a casino too?
Yeah. Every hotel in Vegas pretty much has a casino.
And
it's a beautiful hotel. They have bowling alley, they have movie theater. That's not the closest, but
Red Rock Casino and Hotel is the closest casino to LVI?
It's not the closest. The closest is JW Marriott, but the shuttle that we've worked out with is the Red Rock. It's not very far away. And then there's also the Suncoast that is right close by.
And what's that covered area?
There's also 8 golf courses around LVI.
What's that covered area called, where you walk down the street and there's a roof over the street?
You're talking about downtown, Fremont Street.
I really like that. I hadn't seen that for like 15, 20 years. The last time I went down there, a bunch of us...
You know more about the Strip and Fremont Street than I do. I never go down there.
You know what I want to do when I go down there? I'm going to go down there because I love to drive. I love you. I'm going to see your course, but I also want to drive by that pawn shop.
Oh, yeah.
Pawn Stars?
Yeah, Vegas Pawns or whatever. Yeah.
But what do you think of Invisalign?
Love Invisalign, but it can only do so much. but it's great for, my kids are in Invisalign right now. Well, actually, they're in the one from Five Star Ortho, but it's basically the same thing. But yeah, it works. It'll do, actually, it's funny because David Buck has been working with it to actually expand and do some physiologic changes as well. Whereas most of the time you can't do it. You need to be bracketed for that. But yeah, no, Invisalign's awesome, or any of those liner are awesome.
Do you think the lower cost Invisalign knockoffs are up to speed?
Yeah, the one that we use from Five Star Ortho is phenomenal.
What's it called?
I don't really actually know what the name of it is. It's but all you have to do is say they're aligners. I'm trying to remember what the name of it was, but it's somebody'll tell you. But it's the same thing.
Let's go right into implants. What are you teaching at implants at LVI Global?
Do
you call it just LVI or LVI Global?
Oh, it doesn't matter.
Okay.
Yeah. LVI. Most of the people just say LVI, which, as you know, stands for Las Vegas Institute. But our instructor in the implant course is Leo Moline. So he puts on an implant continuum. And the same thing, by the way, Howard, is on Monday after you take the course, you can go home and start placing implants. Because one of the problems I think with implants is guys and gals are afraid to actually do it. And it is so easy. And that's one of the great comments they get from Leo's course is that on Monday they're putting implants in.
How do you spell his last name?
Malin, Moline, Leo Moline. He's out of Wisconsin.
A cheesehead.
Yeah.
Huh.
So he also does a program in the Dominican Republic where they go down there because you can't do it in the States.
You can too. We found the loophole.
Really, where you can just bring in people and start doing.
You know what it is? What it is? You have all these gazillions of underfunded vets coming back from Iraq and Iran and Afghanistan and all this stuff, and they go figure they don't cover dental and mental. So they cover everything from head to toe except your teeth and your brain. Imagine that. And, but anyway, so these so everybody's been has these homeless shelters. Like in Phoenix has the CAS Center, and the CAS is a volunteer. It's like a 10 operatory deal that just treats homeless vets. So a couple of these places across the country went to their state board and said, well, if a licensed dentist in America comes to this homeless shelter and works on vets for free, can he have a temporary license? Who would say no to that?
Right.
The Arizona State Board Dental Examiner said, absolutely. I mean, so you could do it in Phoenix at the CAS Center so you don't have to go out of the country. And the reason everybody's looking is because guys don't seem to mind going to Dominican Republic or Mexico or Brazil. But a lot of the women dentists have told me and said on Dental Town that they don't feel safe going to some of these places. So you could just scour the Las Vegas homeless shelters and then get a deal with the vet, because they the line outside of the CAS Center in Phoenix, Arizona, when you get there at 8 o'clock in the morning, it's the length of a football field. So nobody in their right mind is going to say, "Oh no, Bill Dickerson's not licensed in Arizona."
Yeah, I was going to say Arizona will allow people who don't have a license.
Absolutely. And so and the directors are telling me, like, yeah, you want to hook me up with people who want to come down and put hands-on courses on. So another dentist heard me say this on his podcast, so he went to his homeless shelter in New Jersey, and the lady said, absolutely. I mean, they want a lot of licensed American dentists to come fix up these vets. And it's so sad, Bill. I was talking to some of those guys down there. Their teeth were actually knocked out by shrapnel and bullets, and it's not covered by their, dental's not covered. So so it'd be a beautiful thing. Like I say, could, it's Chris Volchek runs the CAS Center. He's a dentist friend of mine. We're the same age. He's been doing it 30 years. He was his whole life is the homeless shelter. And but I'm sure you could probably also find one in Las Vegas. I'm sure with all those casinos, there's got to be some homeless people around there somewhere.
People never make it back home.
but yeah, so I'm trying to tell people that you don't have to go to another continent to do charity dentistry.
Cool.
I mean,
we'll look into it.
This is a big country. It's a third of a billion people, and there's a lot of needy people here. But yeah, and that CAS Center is gorgeous. I mean, it's one of the nicest dental offices you've ever seen. And so the implants. The biggest, most controversial question on implants is to surgical guide or not to surgical guide. Let me set up the question for you. Everybody who's 60 years old that's placed 10,000 orthodontists, all the oral surgeons and periodontists, they say, if would you leave on training wheels your whole life? That's, they'll say, I've never used a surgical guide one time in the last 5,000 implants.
Because they don't have to restore it. We're the ones that have to restore it, but on the place that they put it. Do I think you need them? Yes, I think it's very critical. There are so many things that are critical about implants. And this is also, by the way, it falls into the whole physiologic approach. Because if you have the forces going on lateral forces to the implant, they're not going to last. And by the way, you were speaking of the T-scan earlier. One of the advantages of the T-scan is treating implants because that's the last tooth that you want hitting. So the whole timing force, you can put it in and check and see that that's the last tooth that actually hits. And so you're not prematurely hitting or hitting it even because the implant is the last one you want to hit. So my point is, yes, does Leo teach that? Yes, Leo does teach that. And I don't know, maybe if somebody gets really experienced and they can eyeball, that's one thing. But I think, again, having a cone beam for this purpose is valuable as well.
I want you to help me out further. Again, just trying to answer the questions most often sent to me. That they go to a convention and there's 175 different implant systems, and it's not, so help them make a decision. How do you? They don't want to evaluate 175 systems. What are your thoughts on the implant system?
You're right. There's a zillion of them, but I'm not an implant expert. Leo's our expert, so I'm not going. I know that he has developed an implant company or an implant, and he believes that
let's do this.
And his is called Implant One, but I'm not going to endorse any implants. Okay. I'm not there. I'm not an implant expert that can tell you. I think that there's some things that you want in an implant, but I don't know what companies have those.
Well, Bill, let's do this. I think the absolute best marketing and advertising you could do, you do an online CE course. You're doing a podcast with me, do an online CE course with Howard Goldstein. I'm Howard at Dental Town, but now we have two Howards, so he's Hogo because his name's Howard Goldstein. So I'm Hogo, Hogo at dentaltown.com. I'm Howard Dentaltown. And you do an online CE course on neuromuscular, and that'll be informative and marketing info. And then get David Buck and Tim Gross. They could each do a podcast with me, or we could do it all together. They should do an online CE course. And get Leo Malone to do an intro deal, because this is what I think. This is how I just want my homies to get it done. And what I think it is the biggest asset an American will own is their home. The smartest thing they can do, and is not die and have it go to their grandkids, but do a reverse annuity. So they're not living on fixed income. They can sell their house to someone who figures out how long you're going to live, and then you get a monthly check, and then when you die, so you get the equity out of your house before you die, and you're not going to sell that on a 30-second commercial on TV. So what they do is they deconstruct the sales process. They say the whole TV commercial is just get the DVD. No one's going to call you. And then you listen to the DVD, and the whole deal of DVD. Well, just let Bill Dickerson call you and just find out the address of your house so he can tell you what your payment is. And it's a very effective deal. I think it's a big leap to go from I'm going to go all the way to LVI and do these courses. I think a deconstructive would be, well, I'm going to listen to that guy talk for an hour, or I'm going to watch his online CE course for an hour, and then the hour might branch him to connect him to the 3-day course. I think it'd be very effective.
And I told you I'll do it, Howard.
Yeah, yeah, okay.
And I'll talk to the other guys about doing it as well. But yeah, I'd be glad to do it.
And then I want to.
By the way, the reason that you're exactly right is that the commitment. And that's why we're sort of going on the roadshow. And as I said, Virginia next month, San Diego in August, Toronto in September.
Bill Dickerson just said, Howard, you're exactly right. So I want to name the podcast Howard, You're Exactly Right by Bill Dickerson. I think everybody will say, what? I don't believe it.
And then in the end of the year, we're in Houston and then Miami.
I want to go into dentures. I want to go into, when I got out of dental school in the 87, this was going extinct. There was not going to be dentures anymore, preventative dentistry, the country was getting rich, the stock market boom. The United States actually makes more dentures today in 2016 than they did when I got out of school in 1987. A lot of that's fed by over 1 million immigrants a year. It seems like the last 3 or 4 dentures I did in a row, they were just from Bulgaria. Just people who get to Central America and work all the way up and get into Arizona. Um, should dentists really learn about dentures? I mean, is this really an integral part of their
Well,
practice? What are your thoughts on dentures?
my thoughts about anything is if you don't like doing it, don't do it, because you can never be good at something you don't like doing, because you're never going to really work at it or practice it. 80% of dentists don't go to continuing
Yeah.
education because most dentists don't like being dentists. So it's sort of like if you hated playing golf, you wouldn't go to the driving range, right, to hit golf balls because you hate doing it. So I don't want anybody to do anything, whether it be endo or dentures or anything that they don't like doing. I want them to find their passion, their niche, and then do that. I'm not one of those that believe you have to be everybody's dentist. You don't. You can literally become the best at whatever it is that you do and be better off than the jack of all trades. Now, saying that, I think the future is in implant supported dentures. And again, in our denture program, he talks about the whole implant supported dentures as well. But the other aspect is that you need to put the dentures in the physiologic approach. In fact, literally neuromuscular dentistry started because of dentures. Barney Jenkinson used it as a way to border mold his dentures and found out that the jaws relaxed and everything, and then would build the dentures in that position. So it's also the best to do dentures as well. But I don't want anybody having to do dentures if they don't want to do them, because I hated doing dentures. I just hated it. For whatever reason, I hated it.
Bill, there's been some big advances in digital dentures. I'm down here in Phoenix, and right up the street from me, I went to a company in Scottsdale called Avident that's going from a CBC to a denture. Have you looked into that, or any thoughts on that?
I haven't, but again, I don't know if my denture guy, Michael Reese,
Okay, who's your
is
denture guy?
Michael Reese. He's out of Texas, Houston area. So
And
Michael's a great guy,
and
and
where's Leo Molina out of? You said he was out of Seattle?
Wisconsin.
Oh, Wisconsin. Cheesehead. Okay, there it is right there.
And our sleep doctors are out of Montreal in Australia, and Pennsylvania. Because there's our sleep course literally has four of us teaching, and I'm one of them. But the other three are like Anne Marie out of Australia, Sahag.
Well, I want to
Right,
switch gears completely. Let's leave clinical dentistry. You and I have been doing this game for 3 decades, and I want to. Do
You're
you
talking about the speaking game or the dentistry game?
the dentistry game?
And then make it more than 3 decades for
Oh,
me.
you got out of University Pacific in '76.
Yeah.
I got out in '87. Was Dagoni your dean, or were you
Yes.
before Dagoni?
Well, he became the dean while I was there, but I was actually started just before he was the dean.
And how was that being in school with Dagoni?
Oh, he's awesome. Yeah, he was an awesome guy. I mean, he is an awesome guy. Not dead yet, but he's an awesome guy.
His wife just passed.
Yeah.
Poor guy. But man, what a legend! And he singular-handed changed the course of
He did.
because when we were in there, we were baby boomers, and the greatest generation before us was World War II vets. And I think the mentality of all the coaches and deans I had when I was in school was that if you were like a Marine general yelling in your face and just being a total jerk,
Yeah.
that was the motivational technique of the time.
Yeah.
And then it turned to, hey, these students are humans, and if they leave this school and want to turn around and flip it off, they're not going to be very big alumni donors. I remember the first time the dental school that I went to sent me a deal wanting money, and I couldn't even tell you what I wanted to put in that envelope and send it back. I mean, that was, but and now you got deans like up the street here in AT still, Jack Dillenberg, who, the night before the first day of school, he takes all of his students to his house and they just have a big drink fest party. You know what I mean? I mean, it's
Yeah.
he totally changed everything in that. But the question is this: a lot of these young dentists are coming out of school, 25 years old. They're $350,000 student loans. They say, Bill, Howard, you guys graduated in the golden days. We're graduating the era of corporate dentistry, and you guys graduated with indemnity insurance, where you just sent the insurance, you just took your cost, added profit, sent your price to Delta, and they just decided what percent they were going to pay. Now those same insurance companies send us a PPO That's 82% of the dentists in America take PPOs out. 82%, 4 out of 5. And they tell us this lower fee. And I'm competing with corporate dentistry off the street. So, Bill, all this pie in the sky stuff, that was from your day and it's dead. And this is the era of corporate dentistry. What do you say to that?
They're right, but they're also wrong. They're right that that is what's happening in dentistry today, but they're wrong that they can't succeed and be in the. They're not right in the fact that because I believe I came in at the end of the golden age, and we haven't kept up. Dentistry hasn't kept up with inflation probably the last 40 years, but they're right that it's bad right now. That's why think about medicine. Think about how bad physicians' incomes have transpired over the last few years. The only medical specialty that has done well is plastic surgery. They've skyrocketed. And that's because it's want-based medicine. And the problem is that we're presenting dentistry on a need base. We're telling all these patients you need this crown, but they don't need that crown. They can live without that crown. They can live without teeth. They can live without legs too, but they want their legs. We need to make them want the dentistry. So the future of dentistry is want-based dentistry. And what do people want? They want to look good and they want to feel good. And we can make them, the look good is obviously the cosmetic aspect of dentistry, and insurance doesn't pay for that. But the other aspect is that people want to get rid of a lifetime of pain. I think it's $50 billion spent on headache medicine out there. In fact, there's a great book that everybody should get. I didn't write it. It's a great book called Breakaway. You can get it on Amazon.com for $19.95. Breakaway by Fred Abels. He's one of our alumni, actually one of my instructors.
He's a dentist?
Yeah, he's a dentist. And it's about what causes people's headaches and how they can get off their pain pills. But anyway, getting back to that.
Can you email me and CC this guy on Breakaway?
Yeah, absolutely. Sure.
What's his name?
Fred Abels.
Yeah, Abels.
Abels.
Yeah, email me, Howard at Dental Town, CC Fred Abels, and say, come on my show and do a podcast about his book.
All right, I will. So getting back to this is that and one of the reasons that LVI dentists are more successful than the average dentist, and I think the figure now is somewhere around $100,000 more a year, is because their patients want what they're giving them and they will pay out of pocket to have it done. You know as well as I do, Howard, people have money for what they want. They don't necessarily have money for what they need. They don't want it, so they tell them they can't afford it. But they get into a nice car, or they talk about the cruise they're going on, or they have cosmetic surgery done. So what we need to do in dentistry is give them the want. And people want to get out of pain. People don't want to suffer with the headaches or the neck pain or the back pain. And you understand that bite is very related to your cervical posture, your neck posture. And if you can get that in its physiologic position, you can then correct the next posture, which causes so much pain. And you can ask me how I know on that, because I had severe forward head posture that I ended up correcting. But my point about that is that's the future. These young dentists, if they go the normal path of corporate dentistry, yeah, they're just going to be in there and maybe struggling and stuff. They need to become passionate about this want-based dentistry and give the public what they want that no other health provider can. That's the beauty, in my opinion, of physiologic-based dentistry.
Me and my son Ryan and my other son Greg, we just went to lectured in Indonesia, Malaysia, Johannesburg, South Africa. It was amazing, Bill, in these poor countries, how every girl had an iPhone and Invisalign.
Yeah.
And we talking to him, and I say, well, how much in U.S. dollars was that Invisalign? It was like 1,800 U.S., which is just a fortune there, and an $800 iPhone. People have money for what they want.
You know what? There was more money spent last year on big screen TVs than all of dentistry combined. There's your example.
Yeah.
In fact, more money was spent on dog food than dentistry.
I want to ask you a couple another big questions, and I can't believe I get to spend an hour with you on Memorial Day. You're so damn busy. The only day you could fit me in was Memorial Day. They're coming out of school, $350,000 in debt. The whole world's telling them they got to buy a $150,000 CAD/CAM machine to be a good dentist. What are your thoughts on that?
No, they don't have to buy one to be a good dentist. They don't. Is it a cool thing? Yeah, but they don't. To be a good dentist, there are a lot of good dentists that don't use CAD/CAM.
So you're saying you could totally go to the top without that expenditure?
Yeah, I will tell you that I know a whole bunch of people that don't use CAD/CAM, and they're doing incredibly well, and they're phenomenal dentists.
Okay, same
Is it
question.
nice? Yes, but are you going to have a lab bill? Yes, but can you do it? Of course you can.
Okay, Bill, I've been using 3M Emperor gum, for since 1987. Be 30 years next May. They're being told they need to trade in this $18 impression for a $30,000 optical scanning impression. They're made by all kinds of different companies. What's your thoughts on optical scanning versus Emperor gum?
I mean, I think optical scamming, scamming. Was that a Freudian slip? Optical,
Optical
Optical
scanning.
scanning is nice. Optical scanning is nice, but can you do it without it? Of course you can do it without it. Yes, you can do it with impression material. I'm not necessarily saying Impergum is the best impression material, but yes, you can do it with impression material as well. So I don't want anybody to go in debt for something that they can get later on when they start making money. So does a new guy have to come out and get one? No. You can take impressions like you and I have done for years.
Okay, you promised me.
But in fact, one of the problems with the optical scanning is that, as Microdental is having with their Micro 2 is finding out, is that when you do a full arch scanning, you actually lose a little bit, not lose a little bit, and that may not be the right word, but you actually get a little bit of torquing. It's great for like single tooth scanning, but I think it still needs to be improved a little bit to do total arch scanning.
All right, our 1 hour is up that you promised me on Memorial Day, but I got to ask one more question on an overtime. Same question on lasers. I mean, some of these lasers are
whatever you want to ask me, I'm fine. I have the rest of the day, so you're fine. Don't feel like you're being rushed.
Same thing on lasers. Some of these lasers, Bill, are $85,000 to $100,000. If you come out of school with $350,000 in debt, you can double your dental student loans after a CAD/CAM, a CBCT, and a laser. I mean, three things, and you doubled your school debt.
Well, you can get inexpensive diode lasers, for example, and they're not that much. And I think, if I had to guess, I think you can even get some around the $10,000 range. Do I think you need one of those? Yes. Can you get by without one? Yes. But does it make life and things that we do in dentistry so much better? Yes. Now, hard tissue lasers.
Well, I guess we're talking about two. I mean, there's the
You're talking
Allen
about
Miller laser has very low cost laser, $6,000 and under, the AMD lasers. There's that, but then the other end of the spectrum is a bunch of $85,000 to $135,000 lasers.
Well, there's lasers. The thing about lasers is there's laser for everything. One of the things that we use in our clinic on the treating TMD is a therapeutic laser. It's not a cutting laser. It's a therapeutic laser that you apply to muscles and everything to heal things. It's really very cool. And they use lasers, for example, to stiffen up the airway where somebody has saggy airway that's causing obstructive sleep apnea. There's so many different kinds of lasers, and depending on what you want to get into. Again, can you do it without those? Yes, but it's an added tool. Personally, if you want to know what I think one of the first things once they start getting into is what most physicians have is the ability to monitor muscles and an EMG device. Now there's a few out there, but really I think they need the ability to measure the muscles, because the muscles don't lie. The muscles are telling you what's happening with that patient. Just like an EEG tells you what's happening with the brains, or an EKG tells you what's happening with the heart. The EMGs tell you what's happening with that patient's bite. So if they're going to get into that type of dentistry, which I think everybody should, because that's the want-based dentistry, then eventually they're going to need some form of EMG machine. Now, as I said before, there's a very inexpensive one called the M-Scan, where you can just measure two muscles at a time. Well, actually, right and left muscles at a time, but you can move it around and get your measurements of the EMGs. And that's a very inexpensive entry level. So it doesn't take...
And where do they get that at?
That's a bioresearch product. It's called the M-Scan. But it's like, for example, you'd measure your temporalis, or you can move it and then measure your masseters, or you can move it and measure your sternocleidomastoid, which dictates forward head posture. You can measure your digastrics, which will help in your oral mandibular dysfunction analysis. There's lots of things you can move it to. Now, or you can get one that measures everything, that ends up measuring everything. For example, like probably the least expensive system out there that'll do jaw tracking and EMG recording is the bioresearch, and it's like 19,000. Anyway, that's a little bit. And
what's the name of that company? Bioresearch.
Right, they're out of Wisconsin, Milwaukee. But that's a product that eventually maybe somebody would want to get into when they get deeper into being able to analyze. But they need to be trained on it. It's not something somebody can buy and just start using.
Okay. Hey, Bill, on your book, The Exceptional Dental Practice, and the sequel, In Search of the Ultimate Practice, How to Create an Exceptional Aesthetic Practice, 10 Dentists That Have Done It, and Unleashing the Power of Dentistry, are any of these audiobooks?
No.
I gotta give you a tip on these. I gotta give you the marketing tip of the day for your books. The Amazon basically says the Generation Xers, the millennials, they actually buy more audiobooks than hard books. I mean, I could pan to my library. I still love the old books. I like to sit on the airplanes, read them, write notes. But if you the Dental Town app, the next feature being released on it, it'll be released this year, is going to be the audiobook section. So if you ever wanted to sit down in front of Skype, because Skype's got a great sound file. I put my book. I read my book into Skype sound file. It took me 5.5 hours, and now I've sold more audiobooks than hardcover books.
Wow.
But it would when that thing debuts, it'd be so damn cool to debut the audiobook section with Bill Dickerson, the man's audiobook. Any chance we could get your audiobook on that thing?
Sure. What was your book about, Howard? I missed it.
My book was Uncomplicate Business. You only manage people, time, and money.
All
And
right, cool.
so talk about your books. They're all on Amazon?
No.
They're not on
Oh,
Amazon? Where
you
are
can
your
get them on
books?
the LVI store. You can go to lviglobal.com and go on to the store, and there's the books are on in the store
Well,
there.
how many books are on that store, and what should my homies read first?
Well, they're different. The first two, but if you're going to read the first two, uh, the the, um, the Exceptional Dental Practice is before the In Search of the Ultimate Practice. That's a sequel to it. But then the other book, one is on cosmetics and one is on the physiologic approach to dentistry, and that's the Power of Dentistry book.
So you have 4 books then for sale.
Right.
And you know what, homies? I think there's book smart and there's street smart. Street smart people, like before I went to Carl Mish's course, I got his textbook, and I read the textbook before I went down there. And then you're sitting there in this course, and these people are asking questions it was all in the book, and you can tell at the end of the course, they still didn't get half of it. I never understood why people would take and pay for a college class and not read the chapter before they went to the lecture. I mean, people raise their hand saying, "Can you spell that?" But read those books. I mean, go to lviglobal.com, get those 4 books, because they're always complaining to me that student loans, they're blah 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 blah. But
Well,
how
better
much
yet,
each one of those books cost?
well, if they come to Core One, we give them to them for free. So there's even a bigger enticement.
Okay. But Bill, seriously, you're a legend. You still hang out with Bob Ganley of Ivoclar?
I saw Bob. I saw Bob last year, I believe, at a meeting. But Bob is a crazy traveler. I mean, he lives half the time in Liechtenstein and half the time in the States, back in New York. So no, actually, Bob and I haven't seen Bob in a while, other than that one time.
Yeah, he flies back and forth to Liechtenstein. That whenever he's late to the flight, they hold the plane
Is that right?
because
Wow.
he's the most valued customer flying back and
I
forth from
bet. I don't know how he does it.
Amherst, New York to
I mean, that's
Liechtenstein.
literally why I sort of retired from the public speaking in '08, and then sort of doing my passion-filled tour this year, just to get it out there. And my wife and I, again, Heidi and I, are so excited about the new developments that we figure, okay, this is the best way. Let's spend this year and go out and do it. And um, I don't know, I don't know how else to go out there, really. I know you're going to say do your webinar or whatever,
Online
which I'd be
C.
glad. Yeah, online CE. But
Can you believe
anyway,
that? 600,000 course views.
no, that's awesome.
600,000. No,
Yeah,
that's crazy. And
it
and
is.
what I love the most about it, Bill, what's the most romantic is, it's one thing to share information from older guys like us to younger kids that walked out of school. Sharing within a country from someone who's done 10,000 root canals to someone who's done 3. That's cool. But what's really cool is with 220 countries. And when Ryan and I we were driving around Soweto and popping into dental offices, and to hear dentists in Soweto, Africa, or Malaysia saying, "Oh my God, I love the online C," because we make it free in
Right.
the poor countries, and I had this woman dentist in Tanzania just bust out bawling when she found out it was me because she's just watches all those courses and she could never. She said it'd take 3 months income just to buy a plane ticket to the United States to take a course. I
Yeah.
mean, it's just out of the reach. So I think trying to get the most rockin' hot dentists out of the rich countries to put these courses on so they can be viewed by the poor dentists. And it's also a better approach, I believe, to missionary dentistry because when you do missionary dentistry, you go in there like Star Wars with a dozen guys and you do Star Wars for 3 days, but then you leave. And wouldn't it be better to take the dentist there that lives there in the bush, who they all have an iPhone? I've never met a dentist on earth who didn't have a Samsung or an iPhone, and they log on to. I'd rather educate the guy or the girl that's going to be there year round than fly in one time for 3 days and then blitzkrieg out there. In fact, I think the most important thing to do when you do missionary dentistry is get the name of that guy and then have him with you for those 3 days. So you're teaching him all that stuff.
Right.
But then be connected to him because I got guys that'll send an email and say, I really need this. And it'll be like, Novocaine, amalgam, whatever. And then you can send them supplies or you can go to your dental supply rep and say, you got any of this expired stuff? And, send that. But it's more sustainable. But hey, seriously, thank you for all that you did for me personally. Thank you for all you've done. I can't believe how many, what'd you say, 9,000 dentists?
We're actually over 10,000 now. The thing you're reading is old.
10,000 dentists.
And over 10,000 patients have been through LVI. If anybody, by the way, has any questions, they're welcome to email me at wdickerson@lviglobal.com. That's my email address.
And the W stands for Wild Bill Dickerson. Wild Bill Dickerson. So Dickerson at lviglobal.com. Bill, seriously, I will drive to Vegas to see you. Thank you again.
I'm counting on it. I'm counting on you coming to the next core one.
Absolutely. Send me the dates, howard@dentaltown.com. And Bill, seriously, really, dude, thank you for all that you've done for
All right, thank you, Howard. You too.
All right. Have a rocking hot day. And thanks, Ryan, for working on Memorial Day.
Thanks,
just to
Ryan.
Get Wild Bill in here.